Welcome to today's Explainer. So glad you're joining us. Today, we're literally opening up the medicine cabinet to demystify a hidden pharmacological reality. We're going to examine the very real, very potent, and honestly often completely undocumented chemical effects hiding inside everyday herbal remedies. If you've ever grabbed a bottle of natural supplements off a health food store shelf and just kind of assumed it was a harmless daily booster, well, this Explainer is absolutely going to change how you view your own healthcare. Okay, let's dive into this. Does 100% natural automatically mean 100% safe? It's a beautifully appealing idea, isn't it? I mean, the packaging is usually green, it's got these nice pictures of leaves and roots, and we just inherently trust things that come directly from the earth. But as we're going to see today, unregulated natural supplements do not carry zero clinical risks. Actually, these plants pack some seriously powerful active ingredients that can dramatically alter our brain chemistry, our cardiovascular systems, and even how our bodies process prescription meds. Now, check this out. Research shows a massive chunk of us are using unconventional therapies. And while 70% of people actually tell their doctor about it, a whopping 30% keep it a total secret. No way, right? But this creates a seriously dangerous communication gap in our healthcare system. Think about it. If your doctor doesn't know you're taking a potent herbal compound, they literally can't warn you about what it might do when mixed with your daily prescriptions. Bridging that gap is exactly why this explainer is such a crucial tool for your health and your future doctor visits. So here's our roadmap for today. We'll start with the supplement safety myth, then look at Ginkgo, ginseng, and bleeding risks. After that, the St. John's wort warning, the extreme risks of Ephedra, kava's uncalming side effects, and finally, how to talk to your doctor. All right, part one, the supplement safety myth and the regulatory loophole. How exactly do so many potent active substances end up on our supermarket shelves without warning labels? Well, that friendly health food vibe definitely hides a serious lack of scientific rigor. The contrast here is just staggering. With conventional drugs, you've got strict FDA approval, scientifically proven safety and efficacy, and intensely regulated purity. But herbal products, thanks to the 1994 Dietary Supplement Health and Education Act, they basically bypass all of that. They don't need FDA approval to treat diseases, their purity isn't regulated at all, meaning you can have crazy batch-to-batch variability and hidden impurities in the exact same brand. They're legally allowed to be sold just by making these vague claims about affecting the structure or function of the body, stuff like improves energy or enhances mood. It's a massive regulatory loophole. Moving to part two, Ginkgo, ginseng, and bleeding, the circulation danger. These are two incredibly popular supplements, usually marketed as cognitive and energy boosters. But let's look at the hidden risks. So health store marketing claims for Ginkgo biloba will promise you improved memory, better cognitive function, and enhanced blood flow. Sounds great, right? But the clinical reality is a whole different ballgame. The active ingredients in Ginkgo do have strong antioxidant properties, sure, but they also severely inhibit platelet aggregation. Basically, this antiplatelet effect means your blood really struggles to clot, and that has led to medically documented cases of spontaneous bleeding and even severe subdural hematomas, which is literally bleeding in the brain. To put that into perspective, consider this wild real-life case. A 70-year-old man had been safely taking 325 milligrams of daily aspirin after bypass surgery. He decides, totally on his own, to start taking a concentrated ginkgo extract called Ginkgoba twice a day. Well, just 1 week later, he suffered spontaneous bleeding directly from his iris into the anterior chamber of his eye. Yikes. The interaction between his daily aspirin and the Ginkgo product was the absolute culprit. So if you're taking aspirin, you really need to pay close attention to this. And this brilliantly illustrates our next point about ginseng. Now, ginseng is supposed to increase your resistance to stress. But in one case, a 47-year-old man with a mechanical heart valve was taking the prescription blood thinner warfarin to prevent deadly clots. He starts taking a ginseng product for a little energy boost. 2 weeks later, his crucial blood clotting metric, known as INR, plummeted to a highly dangerous 1.5. That drop drastically interfered with his prescription, putting his mechanical heart valve in immediate danger. Okay, part three, the St. John's wort warning. This isn't just some natural mood lift, it's heavily promoted as a natural antidepressant. But beneath the petals of this gentle-sounding flower lies a very potent chemical reality. The active ingredient in St. John's wort is a chemical called hypericin. And hypericin works by inhibiting the reuptake of serotonin, dopamine, and norepinephrine in your brain. Now, if that sounds familiar, It's because it operates on the brain's chemistry exactly like a modern prescription antidepressant. That means mixing St. John's wort with actual prescription antidepressants can cause severe chaotic interactions with your neurotransmitters. But beyond drug interactions, St. John's wort carries some totally surprising side effects of its own, especially something called phototoxicity. Take the case of a 35-year-old woman who self-treated with ground St. John's wort for 4 weeks. Out of nowhere, she developed extreme stinging nerve pain simply from being out in the sun. Even a light touch or a cool breeze made it worse. Her symptoms are ultimately tracked down to demyelination of cutaneous axons. In plain English, that's literally nerve damage in her skin caused by photoactivated hypericins reacting to sunlight. Crazy, right? All right, part 4, the extreme risks of Ephedra and cardiovascular crisis. Now we're looking at a shrub extract that's often dangerously marketed under names like herbal fen or herbal ecstasy. There is a terrifying escalation from what this is marketed for to the actual medical events it causes. Ephedra's pitched for weight loss, decongestion, and athletic performance, but the adverse reactions, we're talking hypertension, seizures, heart attacks, strokes, and even death. The FDA actually investigated over 800 adverse reaction reports linked to Ephedra alkaloids, and honestly, the most frightening statistic, 56% of those terrifying events happen to people under the age of 40. The physical toll of concentrated ephedrine can be absolutely agonizing. Get this, a 27-year-old bodybuilder, seemingly at peak health, was taking up to 12 ProLift ephedrine tablets every single day. He ended up needing surgery to remove massive kidney stones that were made up almost entirely of ephedrine and its metabolites. It's a really visceral reminder that just because something is available over the counter, it definitely does not mean your body can safely process it. Moving on to part 5, kava's uncalming side effects. Kava is heavily marketed as a calming anti-anxiety herb. But what exactly happens when a calming herb goes wrong? Let's take a look. Well, the answer is extrapyramidal effects. Let's break that complex medical term down. Extrapyramidal effects are severe, involuntary, and often super painful motor system reactions. We're not just talking about unexpected drowsiness here. Patients taking kava have actually suffered from oral dyskinesia, which is uncontrollable movements of the mouth and tongue, and torticollis, which involves incredibly painful twisting movements of the neck and trunk. Kava also acts in a really bizarre way chemically. It's highly lipophilic, which is just a fancy way of saying it loves fat. Because of this, kava can actually concentrate right in your sebaceous oils, the natural oils in your skin. In 2 documented cases, this triggered a severe, localized immune response. It left the patients with aggressive, itchy, red plaques covering their face, chest, and back right after sun exposure. Finally, part 6, talk to your doctor. It's time to bridge that massive communication gap we talked about at the very beginning, because it is completely within your power to take actionable steps with your healthcare provider. So the crucial point is right here on this summary table. Honestly, I highly recommend screenshotting this or jotting it down. If you're taking Ginkgo biloba, you cannot mix it with blood thinners like aspirin or warfarin, period. If you're using St. John's wort, you must avoid prescription antidepressants. Ephedra becomes exceptionally dangerous when mixed with caffeine or other stimulants, and kava has devastating additive effects if mixed with sedatives, antipsychotics, or alcohol. Guys, these aren't just minor warning labels. These are severe clinical interactions. To make sure you're fully protected, here's an essential checklist you should run through before your next doctor's appointment. Ask yourself, are you taking any natural remedies? Are you also taking prescriptions for that exact same purpose? Have you used this specific herb before and tracked how you actually felt? Are you allergic to any plant products? And, very importantly, are you currently pregnant or breastfeeding? Bring these questions and your totally honest answers directly to your physician. Which leaves us with this final memorable thought. If you wouldn't take a mystery pill without asking your doctor, why in the world would you take a mystery plant? Stay informed, stay skeptical, and always advocate for your own health by sharing the whole picture with your doctor. Thanks so much for exploring this explainer with me today, and keep asking the right questions.